the metabolic crisis is really an underpinning of our health crisis right now. And then you look at the factors of that, and it's obviously eating, it's sedentary lifestyle, it's chronic stress, it's sleep. But certainly, if you were to rank them, liquefied sugar, which is essentially a new phenomenon, basically a weapon of mass destruction, particularly with the kid, no fiber, liquid form, just literally loading that sugar right to your bloodstream at an unprecedented level of, a human eating fruit or something like that. This is a chief culprit, if we isolate one thing, of diabetes and the metabolic health crisis. And the American Diabetes Association is actually accepting money from Coke and not identifying sugary drinks as a culprit. This is what happens. And that was the playbook. It's rigging institutions of trust.
Welcome to A Whole New Level. My name is Dr. Calley Means, co-founder and chief medical officer of Levels, and I could not be more excited to welcome my brother, Calley Means, to the podcast today. Calley has burst onto the health scene over the last year, really speaking out about the rigged systems of big food, big pharma, big healthcare, big ag, and how they use a really structured playbook to essentially push forward policies that are ultimately making Americans sick and dependent and highly profitable for these industries. He's really struck a chord over the last year on social media and on podcasts, and it's been really fun to watch. So we're going to talk all about that on this podcast today. Calley is a graduate of Stanford University and Harvard Business School. He started his career in the political world before really experiencing a huge shift and evolution towards being a health entrepreneur, a health evangelist, and a whistleblower of these big corporate industries that are keeping Americans sick. He is the founder of TruMed, which is an incredibly innovative company that is allowing people for the first time to use, in a really efficient way, HSA and FSA funding to be able to purchase healthy food and lifestyle products tax-free. So really for the first time, making healthy food and lifestyle products the cheaper option, which in my opinion is something that's going to be a critical piece of the puzzle in reversing the chronic disease epidemics. We've got to make the healthier choices the easier and cheaper options, and TruMed is working to do this. So we're going to get into all of this on the podcast today. So your journey launching into the health space really started on Twitter, of all places. You had a tweet on January 2nd after we'd all been home for the holidays together, and you were talking about how corporations like Coke actually pay advocacy groups to call certain policies like sugar taxes racist so that they can barrel through their agendas that are going to be favorable to corporate interests. And this tweet went crazy. It got 12 million views and really put you in the middle of a national conversation here. So can you unpack what that tweet was about and really why it struck such a chord with viewers?
Well, I've been talking with you for years that Twitter is just another, metabolically unhealthy thing. It drives up that chronic stress. And I've been hot or cold on it, but I really do think this is positive. I mean, that tweet tapped in, in the coming week, I got thousands of messages and they were overwhelmingly parents and moms. And I think what it tapped into is people are trying to put their finger on something that just isn't making sense. I think when you look specifically at kids, something very bad happening. I mean, you've talked about this case, and you will talk about this, but you've been the really leader and inspiration for me on this. But the 30% roughly of teens who have prediabetes or diabetes, I mean, that is an unfathomable statistic. I mean, even with you, pursuing this metabolic health road, I didn't fully understand what diabetes was until very recently. That literally means those poor children, their cells are literally malfunctioning. That's essentially what diabetes is, and prediabetes. Their blood sugar is totally dysregulated, which, as we learned from Levels, is the underpinning of really almost every other disease that is costing our budget and hobbling American life. When a generation ago, as Dr. Rob Lustig has said, a doctor in his profession treating diabetes didn't see a kid in their career. It's just a steady stream they're building they're building, units in hospitals, treating metabolic dysfunction among kids. So I think that's what this tweet tapped into. And, there's so many doctors, from you to Dr. Lustig to Dr. Mark Hyman, who've influenced me and millions of others on the medical part of this. But what I realized in connecting the dots recently, what I did see is there's real corruption here. And it's, working with these folks, looking back on my early career in politics, they weren't evil. They weren't going back home thinking that they're evil, working with, Coca-Cola, working with civil rights groups to try to convince lower income kids to drink soda, that that's okay, and get federal funding for soda. But I think there's just nefarious interest. It's just as simple as follow the money. The fact that Coca-Cola receives a large portion of their money from government programs for lower income folks, from food stamps, $10 billion goes directly from the government treasury to soda companies every year. It leads to incentives to have people justify why they keep those programs going. And, in the rooms with the NAACP and Coke, again, paying these civil rights groups to say that it was racist to cut funding for Coke. It was, oh, we don't want to take away choice from these lower income kids. Oh, we don't want to be paternalistic. But of course, what's paternalistic is having not just food stamps, but school lunch programs, agriculture subsidies. All in all, I calculate it's over $100 billion a year. We're really subsidizing ultra processed food. So just Casey, on my journey, just getting out of politics, getting more into entrepreneurship, seeing your journey, being inspired by the doctors that are in the Levels network, and our own experience with our mother, who really, I believe, and I know you believe, her life was cut short due to metabolic dysfunction. And then seeing my kid recently born, our first son, Rourke, go into the world, and watching the world kids are going into, really not just diabetes and pre-diabetes, but fatty liver disease at 20% of teens, and 40% of high school seniors having a mental health disorder, rates of almost every condition skyrocketing among young adults. It helped me put the pieces together, and I've been happy to kind of try to give a voice to the incentives I saw, working with these companies.
There are so many things I want to follow up from that answer. And I think, but I would really love to hear, like, you had this really unique perspective early on in your career, like really being inside the room where some of these conversations are happening that ultimately lead to policies and agendas that are keeping Americans sick. So, can you paint a picture of what some of these conversations were like that you were privy to in the early part of your career with the food corporations that ultimately lead to these downstream issues that are allowing for sugar to basically be in everything and be subsidized by our government?
You saw me early on, and like a lot of people, I wanted to get into politics and public policy. Growing up in DC, we were very inspired by my dad. I had ego was involved in, wanting to be impacting policy. But I really, we grew up in DC, and I really did, I think, have good intentions, and wanted to get on campaigns and help American competitiveness. And what I learned quickly, initially starting on campaigns, is that people from both sides of the aisle, after the campaigns, they inevitably get pulled into lobbying and consulting for companies. And the two biggest spenders in DC, number one is by far pharma. Pharma spends 3 times more in any industry, 5 times more than the oil industry, which we hear so much about. And then food, obviously, one of the most employed and important industries in the country. So inevitably, I found myself very quickly sitting across the desk and helping those two companies. So in the case of food, I don't think we fully understand, it's not an evil conspiracy. It's just incentives. Everyone eats food, right? And these food companies are trying to make food cheaper and more addictive. And just as the social media companies are, having data scientists figure out how to raise our dopamine levels and get us to stay a little bit longer in social media and have dopamine just keep getting that little nibble so we stay on. It's the same thing with food companies. And I wouldn't even say this is that evil, but to think that there aren't thousands of scientists that are working at food companies figuring out how to, I say, weaponize food to put that perfect natural flavor in, to make it a little bit more addictive, to put that perfect balance of fat and sugar, to add that sugar, significantly more sugar than we're evolutionarily made to eat, to rise that dopamine signal. As Mark Hyman said, if you do a brain scan, it's the same areas of the brain that lights up when you take any other drug like heroin, sugar, different scale, but it's the same mechanism. So that's happening, right? And as we know from levels, that's leading to, really our food and other metabolic habits are leading to the bulk of the deaths and healthcare costs in the United States. But food companies want to protect that. So the what they do and the way food companies protect and really I think gaslight what's happening, which is that we're all getting sicker because of food, is they pay off institutions of trust. So it's really quite simple. When you have an issue like people asking whether we should be funding in food stamps, sugar water, diabetes water, Coke, $10 billion, whether we should still be having subsidies for sugar, whether the USDA should still be recommending sugar for kids, which they do today. You just go down the list. Who do our stakeholders trust? The civil rights groups, it's very simple and it's still happening today. And it's just the raw reality of it. If you call someone racist, if you call someone a sexist, if you call someone an inflammatory thing like that, it's going to shut down debate. So it was pretty shocking sitting in these rooms with Coke and the NAACP and other civil rights groups. But it really is pretty much that transactional. It's like, hey, we don't want Coke to be taken away from lower income children of color. Can we do an exchange of funds? And can you do some PR and make some statements about how there's really racial bad motivations of taking this Coke away from these kids? It's again, these people don't think they're evil, but it's a very transactional conversation to rig the debate. The other group and the other lever of trust that influences both consumers and, very importantly, lawmakers and regulators is just research. And I was very surprised that as a junior person at one of these companies, I was creating lists of nutrition researchers. I learned that food companies spend 11 times more on basic nutritional research than the NIH. So if you look at what led to the food pyramid in the 1990s, which said we should eat, less healthy fats, more carbs, less protein, shift to sugar and carbs. That the foundational research for that was Harvard studies, paid for by the American Sugar Council. They didn't even try to hide the name back then. It was the American Sugar Council. And up till today, you have the NIH study saying that Lucky Charms are healthier than beef, from the Tufts University, funded by the NIH, also funded by food companies. So what we did with Coke is we worked to really create a donation strategy and a research strategy for nutrition research. And some of the studies still to this day question whether sugar causes obesity, which is just a scandal. But the fact, even the studies just saying different things, just confusing whether obesity is caused by saturated fat or X or Y or Z. We see the news every day. Just the fact that there's a little bit of confusion is the goal. So that was one. And the last thing I'll mention, Casey, which is just shocking. And I keep mentioning Rob Lustig, but he's a warrior, and this obviously has had a big impact on us. But I saw donations from Coke and a strategy to directly influence the medical groups themselves. The American Diabetes Association and the American Academy of Pediatrics specifically have both accepted millions of dollars from Coke. And you step back and you just think about, you accept the fact that the metabolic crisis is really an underpinning of our health crisis right now. And then you look at the factors of that, and it's obviously eating, it's sedentary lifestyle, it's chronic stress, it's sleep. Certainly, if you were to rank them, liquefied sugar, which is essentially a new phenomenon, basically a weapon of mass destruction, particularly with the kid, no fiber, liquid form, just literally loading that sugar right to your bloodstream at an unprecedented level of, a human eating fruit or something like that. This is a chief culprit, if we isolate one thing, of diabetes and the metabolic health crisis. And the American Diabetes Association is actually accepting money from Coke and not identifying sugary drinks as a culprit. This is what happens. And that was the playbook. It's rigging institutions of trust.
If you've heard me talk on other podcasts before, you know that I believe that tracking your glucose and optimizing your metabolic health is really the ultimate life hack. We know that cravings and mood instability and energy levels and weight are all tied to our blood sugar levels. And of course, all the downstream chronic diseases that are related to blood sugar are things that we can really greatly improve our chances of avoiding if we keep our blood sugar in a healthy and stable level throughout our lifetime. So I've been using CGM now on and off for the past 4 years since we started Levels, and I have learned so much about my diet and my health. I've learned the simple swaps that keep my blood sugar stable, like flax crackers instead of wheat-based crackers. I've learned which fruits work best for my blood sugar. Like I do really well with pears and apples and oranges and berries, but grapes seem to spike my blood sugar off the chart. I'm also a notorious night owl, and I've really learned with using Levels how if I get to bed at a reasonable hour and get good quality sleep, my blood sugar levels are so much better. And that has been so motivating for me on my health journey. It's also been helpful for me in terms of keeping my weight at a stable level much more effortlessly than it has been in the past. So you can sign up for Levels at levels.link/health, get access to a continuous glucose monitor and the Levels software that helps you really dial into a lot of these strategies for your life and your body. It's so powerful, Calley, when you lay it out, rigging institutions of trust, hijacking the research industry, 3 times more lobbying than any other industry, and then seeding confusion to just get people a little bit confused so they don't know what the right answer is. Like it's a brilliant playbook, to be honest. And I so admire that you've put this all together. And I kind of want to ask you a little bit about your journey, because obviously I've been up close and personal of your sister, but it is so fascinating. And I think your journey is really like an archetype of hope for what other people can strive for in their careers. Because I think a lot of people we know, just a lot of people in the world, they're going along, doing their career, they're enjoying it, they're exhilarated, they're liking their work, or maybe they're not, but are maybe not seeing how they are playing a role in a force that may actually be detrimental to, society in a way. Like, you were in the beginning of your career, you were loving it, and now only like it's like been 10, 15 years and a lot has happened since then, and now you're looking back on it and can see things really, really clearly. So I wonder if you could just like lay out a bit of like, how have the dominoes unfolded for you to have this really like this awakening? And I just look at you and your career right now and what you're doing, and you're on fire, you're electric, you are living your passion. But it's a journey, it's a lot of dominoes having to fall and a big web. And so I wonder if you could walk through a little bit about how that unfolded, keeping in mind just honestly like advice for maybe other people of how to take stock of their lives and what they're doing with their time, and how to really understand, like, to move in a direction towards purpose like you have found.
So everyone's journey is unique, but here's my takeaways. So Casey, I don't need to tell you this, and we're still trying to unpack this with therapists, but for some reason we were, from early age, success driven, just like trying to get go up the standard pathway. I thought consulting for pharma companies and working for, the up the fairway politicians and heralding how great our food system was. And, frankly, like trying to go to the good colleges, Stanford, Harvard, pride of the family, Stanford Med School, surgical residency. I mean, this is the first thing we talked about, was kind of the traditional mechanisms of success. And I think a lot of people can probably relate to that in just various ways. It's like we have a success kind of go up the ladder. And my journey is very influenced by you, Casey, because again, I mean, like, it was the foundational to your identity. It was really core, at least publicly, to our family's identity, that your success is up the ladder of medicine and worrying through that. And, when you, just the listeners know kind of your story, when you were looking at your patients and saying that they weren't getting better, and realizing that at Stanford Med School, they don't require one nutrition class, and everything you have dealt with is, really committing surgery on was inflammation, but you didn't even understand where that inflammation was coming from. And you abruptly left. I mean, that was shocking. I was, still very traditional minded. And I was like, what the, we had, a tough couple of years. I didn't understand what you were doing. I'm like, you're throwing your life
Yeah.
away, 12 years of training. It was so scary. I was scared for you. It's just like, what are you doing? This isn't the path. And I do feel like institutions are just the centrifugal force to have people go into these traditional industries. And I feel like that is financial incentives. This isn't conspiratorial, but Stanford Medical School or Harvard Business School or these institutions, there's great benefits to many of these institutions, but they are paid for, and they're mechanisms of traditional industry to and really are conveyor belts to feeding cogs into the traditional industries. And I do think when you step back, and most of us would agree, these traditional industries, from finance to, the environment to health, to education, they're failing us. And that's just kind of the disconnect I'm seeing. Going to Harvard Business School, a lot of my friends and me, write our essays about changing, the world. And then 85% of the class goes into a traditional job at a traditional industry. Now, that's not any shade on anyone else, and everyone's on their own journey. But there's a mismatch to that. And interestingly, this impacted me at Harvard Business School where I went. They did a study of graduates 10 years after graduating from HBS, and it was the most clinically depressed group of people this professor studied. They studied a bunch of different socioeconomic classes. So just from that little vantage point, I think you have this thing where, doctors and, people that go to these good institutions, they're kind of like feeling trapped in these institutions. And there's like epidemic levels of depression. There's, doctors have the highest suicide rate and one of the highest burnout rates of any profession. So I just think that's just worth acknowledging. Okay. And what I learned from you, Casey, is that having that bravery, having that pushing back against that sunk cost fallacy, that I've done 13 years of this and I have to keep going, which so many people, and totally makes sense, right? Um, that you could thrive on the other side. That had a huge impact on me. The second thing that had a huge impact on me is, a foundational moment for us in 2021, where our best friend, our mom was, perfectly healthy, thriving, but had a pain in her stomach and went to the hospital and got a scan and realized she had stage 4 pancreatic cancer. 71, had just bought a RV with my dad to travel the country and a boat and to have a good time, and had so many plans, and abruptly was dead in 13 days. And that was around the same time as I was selling my other company, really kind of thinking hard about COVID and how our health institutions had let us down, and spending a lot of time with you, Casey, and just being so inspired by how you had thrived, and thinking a lot about my early career, being really ideological and mission driven to help American competitiveness, but really seeing, particularly with COVID, highlighting that if we have an unhealthy population that's not at their best, where literally our brains and bodies are systematically breaking down, and we're not talking about that, that's really the first order issue. The fact that during COVID, which was a condition that really essentially only killed predominantly metabolic and healthy people, like most other conditions, that we weren't talking about metabolic habits, there's something really wrong here. So I was really thinking a lot about that. And then this experience with mom, um, did a couple things. It reiterated, of course, this foundational belief on metabolic health, because she had prediabetes, which is very tied to many forms of cancer. And the doctors at, Palo Alto, as she was dying, was saying how unlucky it was for her to have pancreatic cancer. But, a lot of these conditions aren't luck. They really are tied to metabolic function, which leading doctors don't even totally understand. And then the last thing, Casey, just to tie it all together, is just, burying unexpectedly our mom, and thinking about these issues. I just think it's a cliche, but it's very true. It's just like you've only got one life. And, I think we are, and I think many people, when you really dig down, are in a privileged position to, you know, exert their talents where they feel like there's a big problem. And what I learned from you is, even without a big plan, if you really do that with good energy, it can work out in many ways. So that's what led me to this. And it led me to start just speaking out in ways that I might have been scared to before, and just let the chips fall where they may, because life is short. And I do think in this era where where institutions are failing us and we need systemic change, more people need to speak out.
Oh, it's so beautiful, Callie. I mean, it's so crazy because I've like lived through all of this with you, and yet hearing you talk about it still inspires me so much. And I think that fundamentally what I'm hearing you say is a lot about examine our relationship with fear and scarcity
Mm.
and sunk cost and waking up from those things and really looking at this life as precious and finite and abundant. And a lot of the constructs we create in our heads that are culturally sanctioned, they are keeping us limited in paths that may not be serving our highest purpose. And so there is an element of, you know, bravery and just realizing that like there is something on the other side of the choices that you might be in right now. And you may not know exactly what that is, but I mean, this is one of the reasons why our family's like very, we talk a lot about gratitude, but I think that one of the reasons gratitude is so powerful is because it helps shape your brain to realize that there is so much abundance in life, and abundance is the antidote to scarcity, and scarcity is fundamentally rooted in fear. And so just shaping your life around how much, there is an opportunity, I think to me really feels like the foundation of having some of that bravery that you're talking about. And I want to just maybe use this as a little segue because I think another piece of your journey that was after, mom dying was that was right when you were having a child, your first child,
Mhm.
Rourke. And to me, that also feels like a huge part of this journey because it became then not just about you, but about this child that you were bringing into the world. And nothing has been more inspiring to me than watching you become a father and how you're not only working for you and your passion and what America needs, but also what this baby needs. And so I'd love for you to talk about how being a father has impacted this passion for health and maybe just touch a little bit about why you are so fired up about children's health as it pertains to our rigged institutions in this country and corporate interests above, human interest.
Yeah, let me just start really high level. Because I used to be, I studied economics, and I'm going to start really high and drill right down to having a kid. But, when you think about the economy, the foundational unit is individual humans. And the point of the economy is for people to be like happy and live meaningful lives. And so the base unit is a human. And I think the metabolic health framework is the most important framework in the world because because if you get metabolic health right, that baseline unit, those inputs in the economy are thriving, are inspired, are feeling good, are operating at their best. It's just so simple. But if you ignore the pillars of metabolic health, if you're getting crappy sleep, if you're not eating well, if you're putting 75% of your fuel ultra processed crap that we're not biologically made to eat, if you're constantly experiencing chronic stress and not doing anything to manage that, if you're living sedentary when we are made to be in the sunlight and moving, you are just not going to be at your best. And if you add that and add the statistics about the fact that we're getting 2 hours less sleep than we did 100 years ago, that we're massively more sedentary, that we're eating and putting in our bodies just absolutely, processed inflammatory crap, you multiply that out, you just have the economy, you just have humans, kids, just not at their best and just not living an inspired, like thriving life. So it's a disaster, I think, just caring about American competitiveness from the high end. I think it'll be the existential problem in our country because we're becoming a sick, depressed, infertile, very infertile, and overweight population at an exponential rate while bankrupting the country. But it's also thinking about the kid. I just think, why is this happening? Like why are pediatricians, essentially saying that the most important thing you can do from your kid is give them a pharmaceutical 70 shots, which many of them might be important, but there's much more to health. But that's essentially pediatric medicine. They hand you a pamphlet, literally with the advice from the American Academy of Pediatrics. Their first food should be puffs, processed puffs. That is literally what the American Academy of Pediatrics. And then it's just this pharmaceutical bandwagon. No discussion of how that kid should not be eating ultra processed food, of the metabolic health crisis. That in fact, it's almost encouraging that metabolic health crisis for the kid. That kid's walking into a space where we're absolutely getting bombarded with chronic stressors, where SSRI intake among high schoolers is totally normalized, but there's no curriculum in any public school that teaches meditation or stress regulation management, where the school start times by the major sleep foundations and researchers in the country are all saying that it's absolutely detrimental to their circadian rhythm, which is one of the most important parts of development, and nobody's changed that. So we have almost like this like violent on every level. I use the word violent, but I think it is. It's very destructive. Almost every lever of metabolic health that the kids walk into. And I think as a parent, the best thing you can do is just set the brain and body of your child up, to thrive and deal with the inevitable. But, if we don't have children knowing stress regulation techniques on, mistakes I and inevitably the world will make, and being able to manage that and being able to meditate and being able to know the principles of mindfulness, if we don't have kids with a great relationship with food and sleep and movement, I think it's setting them up for lack of success. So that's kind of my, like, I really think actually, like, if I were to wave a magic wand, and really what I'm trying to do with TruMed and speaking out and working with you, Casey, is just like, I think we can move public policy to really be thinking about as the foundation of public policy. How do we improve metabolic health, particularly in our kids? I just think it's the most important, if you think about it, just obviously the most important like lever of society, the highest leverage point. But yeah, you can just start at home and watching these precious little guys, and particularly my little guy. Kids are born perfect. They have a predisposition to natural food, to movement, to curiosity, to awe. And I do think society, through frankly corporate interests and some rigged institutions, see a healthy kid as unprofitable and a sick kid as profitable, and a kid in fear and parents in fear is profitable, and send us in the wrong direction. So we got to ask questions, Casey, and you inspired me through asking questions through the medical system, and that's the path I'm on.
Well, let's get practical and tactical for parents, because we have a lot of parents who listen to this podcast, and I'd be really interested. Like, you are, a total health evangelist and have really embodied this passion over the past few years at the same time as you're becoming a parent. And so I'd be curious, what are you seeing as a new parent? Your work is what, like 16 months old now, and like, what have you seen over the last year and a half? You mentioned the puffs and the American Academy of Pediatrics giving terrible advice about food, but like amongst your peers, amongst culture, like, what is the landscape of being a new parent like right now, and what is the battle that people are fighting, and what does healthy parenting look like to you? What are some things that
Right.
what are the frameworks that parents should be using as they have a new baby for healthy lifestyle? Some of the key factors.
Great. So I'll start with the top down, kind of how I think about it, kind of from the incentives of the industries that impact your kids' health, and then I'll talk bottoms up on some tips we've been working on together specifically for our child. So from the top down, I do think there's a big mindset shift, and I think parents need to get out of this mindset of fear that the society and institutions are trying to get you in. So I just want to like set the table. Healthcare is the largest and fastest growing industry in the United States. Um, that is just crazy when you think about it. The largest and fastest growing. And I have a tech company. We both do. Generally, innovation in most industries like tech means lower cost, better outcomes. In healthcare, it's higher cost, worse outcomes, and it's growing faster than any other industry. So that's the situation. There's more people employed in health than any other industry, and those incentives, that amoeba that's built to grow. Again, not even pointing fingers at evil people. It's just the incentives of this institution that's bigger than any one person. The most important thing for that system is to get sick people in the system and to get them in for longer periods of time, which means getting them in early. The fact of the matter is getting a child onto the chronic disease, pharmaceutical, medical pipeline is very profitable. The 30% of kids having prediabetes, that's 30% of teens in the United States needing to go regularly to the doctor, right, for blood tests, for subscriptions, for other issues. And then, of course, right, when you get to diabetes, 98% have at least one other comorbidity. Diabetes, as we know from levels, is the blood sugar dysregulation, and many people are on a spectrum, far wider than diabetes, prediabetes, others. It's the foundation. So you're gonna have those 30% of kids, they're gonna just have to be on the blood pressure medication, have to be on the statin. They're going to inevitably have fertility issues. They're going to be on an SSRI because depression is highly tied to prediabetes. So you're just going to have all of these appointments, all of these different. So just taking any motive away. And I think we get to, oh, that's a conspiracy. This is just if you were to dictate the incentives of what the system, agnostically to any morals, just would want. That's it, and that's what's happening. So that's what your kid is being fed into. And I just think from a mindset thing, a lot of these podcasts, inevitably you get some advice and you say consult your doctor. And I'll just say it. Chronic disease prevention with metabolic condition prevention. Let's be very clear about this. When it comes to preventing metabolic conditions, preventing heart disease, diabetes, obesity, depression, et cetera, for your child, you should listen to your doctor, but they do not deserve the benefit of the doubt. The track record of the medical system to addressing and preventing metabolic conditions has been an absolute failure. Every single condition, from autoimmune conditions, allergies, cancer, Alzheimer's, diabetes, heart disease, kidney disease, everything, it's all going up as we're spending more to treat it. Why in God's name would we tell parents, don't question the science? Don't ask one question to your pediatrician. They've failed us. So I just would tell parents, and I think we do need to understand, humans are the only humans and animals we've domesticated like dogs that are systematically have metabolic dysfunction. Like there aren't systematic rates of diabetes and heart disease and obesity among wild wolves, but dogs who we feed our crap and keep sedentary in sunlight out indoors have a 50% rate of depression and an over 50% cancer rate. Over 50% of them are obese. So that's what's happened to humans. The only difference between humans and every other animals is that we're listening to the experts on preventing metabolic dysfunction and getting terrible advice. So that's just one thing I'd say to it. It is not conspiratorial to trust yourself and your own intuition with kids. Now that gets a little bit more into the specifics. And the specifics, as I think you, Casey, and Levels and the network has done a really good job, is that there's a lot of incentives to overcomplicate it, but it's not that complicated. When it comes to food, we need to look at what we're eating. And ultra-processed food, which again is what all kids are being pushed onto, the puffs and the packages and all these things. The foundation of ultra-processed food is 3 ingredients. It's added sugar, which amazingly many kids' foods contain. We're dramatically, obviously, eating more processed sugar than we did, 100 years ago. Processed sugar really is a new invention. It used to just be fruits and, very rare. Now it's in all of our food. Highly processed grains. Highly processed grains are an invention in the last 100 years. The processing takes the fiber off, takes the nutrition, and the fiber, of course, blunts the glucose impact. I'm speaking to the expert here, but thanks for letting me do it, Casey. I've learned this all from you. And then seed oils. Seed oils, you can go down a big rabbit hole on that. But I think the core point I'd make on seed oils is I think getting into a debate on what, whether that oil's best, it misses the point. Seed oils are a brand new invention in the last 100 years. They're a highly processed industrial byproduct that our body isn't biologically made to eat. It's not a food that we've accustomed to eating. And now it's the top source of American fat. So just the fact that we're even in a debate whether that's good or bad, it misses the point. The foundation, those 3 ingredients I mentioned are essentially new ingredients that are the foundation of kids' food. And if you as a parent can just scan the label and cut those 3 ingredients out, you're almost forced to feed your kid mostly processed food, or potentially some great brands like Serenity Kids, like I really like, which is just like pasture raised meat and, olive oil, like really good ingredients. But you're basically getting 80 to 90% there, in my opinion. The last thing I'd say on food is, there's all this talk about the parents and the birthday parties and giving the kids the sugar. And it's crazy. I mean, it is like a big peer pressure thing. It's everywhere. I mean, you were like a weirdo for not giving your 2-year-old sugar. I think there's 2 dynamics there. Number one is that those parents are following USDA recommendations. I think the most shameful policy in the United States right now is that the USDA says that American 2 years and up can have 10% of their diet, up to 10%, as added sugar, 10%, which is just unconscionable. So I do think at the USDA and Dr. Fauci and the head of the NIH, as we saw, people listen to the Dr. Fauci's of the world. People listen to their doctors. And people do what they say, quite frankly, and for better or worse. And I think that we need the peer pressure to go the other way, and we need medical leaders to follow the science and say the truth, which is that kids shouldn't be eating sugar. I don't want to ban sugar. I also don't necessarily think we should ban cigarettes or alcohol, but I don't think we should be recommending it for kids. This is a free country. I'm a libertarian, but thinking something should exist is different than recommending to kids. And again, just as we don't recommend cigarettes to kids, we should not be recommending sugar to kids. So that's it, Casey. And the last thing, and can take it wherever you want, but the last thing I just say is, I think education, the other important institution, I think that's letting us down, is very tied to health. I think, where do we lose our way where, watching my son at 16 months old, the fastest learning curve of his life, all he does is get up each day and explore the world and play. And he's learning to talk, he's learning to walk, he's learning to regulate his emotions, he's learning he's learning more at a faster rate than he ever will in his life. And it's almost as if schools take those learnings of what actually works for exponential learning growth, of kind of play and curiosity, and just sits 5-year-olds at a desk and almost just like does the reverse of everything that's worked up into that point in a sedentary, sunless room for 7 hours a day. So I think there's something really wrong with the connection between education and health, particularly early childhood education, which there's a lot of people thinking about, and I'm digging into.
And not to mention with school lunches, like you touched on, Nora LaTorre, who's the CEO of Eat Real, an amazing organization, talks about how public schools are the largest fast food chain in America. They are serving essentially fast food, largely ultra processed food, like 3 billion meals a year, that is essentially, like, by and large, not supporting the health of children. So in addition to the, putting kids in chairs indoors, windowless rooms, not moving, also, of course, being gavaged with this ultra processed food. And so I wonder if you could just briefly paint a picture of what you've made a lot of very intentional choices with work and his early life. What does a day in the life of Rourke look like? And how have you essentially designed his days to support his optimal health based on everything you know about the health world?
Yes, the framework I use, again, I'm just repeating what I've learned from you here, Casey.
No,
So
but you're
so
putting
grateful
into
for you.
action. I haven't been
But
a
the
parent.
framework I have used is that the metabolic health pillars aren't that complicated. I think the most important is food, movement. If you put any animal, sedentary, locked up in a cage without a lot of movement, they're going to essentially go crazy very quickly. That's what's happening systematically in humans by choice. Sleep, chronic stress management, and then sunlight and environmental toxins are kind of the pillars. So I think you just go down each of those areas. And I think in each of those areas, and this is another thing, right? And you hear this a lot. It's like, gosh, should I really need to worry about my Tide laundry detergent? Or God, sometimes people follow, frankly, people like you on Instagram, Casey Health. It's like, gosh, is everything just screwed? Do I have to worry about everything? My thought is that it's actually kind of empowering, and you're never going to get it all right, but we have lost our way. Now, I wouldn't want to go 100 years back where we didn't have, light in the house and didn't have modern amenities. But the pace of innovation has been exponential and astounding, right, in the past 100 years. And we have a lot of good things, but we have lost our way in core areas. And we have got to be aware and pay some taxes and take some personal accountability, more than I think most people understand, or the government or the institutions are telling us we need to kind of rejigger. Our water is poisoned. Our air is not great. Our environment with our supplies around the house are not great. Our food is poisoned. I believe the government's completely let us down. There are many chemicals and pesticides that aren't even allowed in most other countries. There's a lot going on. And thinking about each of those pillars. So to answer your question, and I know you said briefly here, Casey, but food, try to do whole foods. Kids are made to choose some meat, some pasture-raised, grass-fed steak, or if you're more on the vegan train, organic vegetables. But really just figure out, I mean, it's been a journey for me. Just give your food what you should optimally be eating. And I will say, you can't control and lock your kid up. That's going to cause much bigger problems, and totally monitor what they're eating when they're like, in high school. But you as a parent, from 0 to 2 have full control. And I do think, and I put this a little, all parents are on their own journey, but geez, I mean, you set your kid up in their microbiome up in their body up for a lot of good things if you can just feed that kid natural food and stay away from the sugar, seed oils, and highly processed grains. I think getting out in the sun, just as a tactical tip, um, the research on that, Casey, you've written some great posts on this. Dr. Huberman and others are talking about this. It's crazy science. I mean, it's just amazing. I mean, our body's on a 24-hour clock because of the sun. So much of our evolution is because of the sun. It's not an incremental. I thought it was a little frou-frou back in the day. This is very important. And getting Rourke out in the sun is very important. Making sure he has time to move. And then, I think parenting is, for me, a wake-up call. And Casey, we've obviously been on this journey together and getting a lot of good feedback from you and a lot of loving support. But I think it's a wake-up call for your own metabolic habits. Chronic stress management is like really important, and and making sure he's regulated and able to manage his stress. And the way to do that is for me to provide a model of that. So, it's just, I think it's going and being curious on those 5 pillars as I'm on a journey for reading, metabolic health experts and frankly Levels blog, and just working to improve myself on eating, on stress management, on sleep. And at the very least in the first 2 years, really have a controlled environment for him where he's getting off to the right start. Because as Casey, we always say, any problem we have is probably our parents' fault when we were 0 to 2. I mean,
we love blaming our parents.
But there is, we've had sleep issues and stuff, and we had the best parents in the world. But I do think the more you dig into this, it's giving your kid a big favor if you get their microbiome right, their food right, their sleep right. You're never really going to have ups and downs, but I think that's really sets the right baseline.
I've learned so much from you. I'm so glad you went first having kids, because I am just going to basically follow your and Leslie's model completely. It's amazing. And it's so beautiful. And Rourke is just the happiest baby and never gets sick and sleeps perfectly. And it's amazing what you guys have done. This is like a different direction I wasn't totally planning on going in this podcast, but I think it's interesting because, we're chatting and we're talking about family and whatnot. We're in an interesting place right now where we just wrote a book together. We're obviously on the same mission here. We both have companies in the space that are working to change the incentives of healthcare and empower people to be healthy. You're taking Dad to England in a couple of weeks to go to Russell Brand's conference. I write articles with Dad. We're in a family. It's a family affair of metabolic health right now. And so I'm just curious, what are your reflections for, I don't know, maybe other people who are listening who are maybe not on this type of journey with their family, this kind of purpose-driven family, or are struggling with family dynamics. What are some of the takeaways you've had from the last, honestly, few years, but even longer, of what it looks like to build a family culture that is healthy and connected in adulthood, and where you can work well with a family together? I'm curious to hear what your takeaways from this whole journey has been.
Well, one big one, Casey, is you can't control anyone, as you've really, I think, elucidated very well, and I think I've learned from you, is and by this I mean we have a dad who's just our best friend, who's really healthy and practicing great habits, but like any person in their mid-70s, we're worried about his health, and a lot of our friends are worried about their parents' health. And as I got radicalized and felt more knowledgeable about these metabolic health issues, I got kind of angry at him. I'm like, Dad, you gotta do this. You gotta do the cold plunge every day. You gotta eat the, and that energy didn't work very well. And then you helped me on this, but I think actually just focusing on myself and the energy I brought, and really not releasing control over him. I mean, Casey, you said something very powerful, if you don't mind me sharing, but just that, it's almost an extreme stance on it, but you'd rather him die early than us have controlling impulses, that the controlling impulses and tell me if this isn't right, but just like almost like can sour the time that's here, and it just is probably not even going to work. And just so it's just like that was very stark to me. It's like, I think I and a lot of people think, oh, I can get my parents on the right track if I'm, just kamikaze on it and just all that. And that's I've been very aggressive in my life, as you know, and that's been a big lesson. I think the more you can just put good energy, particularly on this health stuff and this trying to grow, that I think, not that the outcome is the goal, but I think has influenced him a lot more and brought us closer, because people inevitably pick things up, and I've been impacted most by other people, not with them trying to control or micromanage me, but just seeing their example. So that's been a big lesson with family. I also would say, Casey, that things change. I mean, very quickly. I mean, every family has struggles, and even you and I, have had different periods of closeness. And that period, as I said, when you left med school, and I thought that was the wrong decision. Um, and we had periods, years ago, where our mom was worried and really trying to get us to be closer together. And I just think things can change if you're focused on yourself and open to that. And I would have never predicted how close we'd become, and how such a traumatic event, mommy's death, would bring us closer together on this mission, um and just where we are now. So, I don't think it's that we have some perfect, um thing that's never had ups and downs. I think for me the big lesson is, I don't know. I think it's what you've done, Casey. Just focus on your core mission, your core principles, who you are, your principles for life, and then the universe, usually good things come around to that. And that's a I don't know,
Mm.
that's something I'm trying to work on every day. With you, Casey, with my amazing wife, with thinking about being a parent. Um, it's just putting good energy, putting good principles out there, but like you're not gonna succeed by trying to control anything too much.
Oh, so wise, so beautiful.
Well, what?
No, I love that. I think that's
Yeah.
totally right on, and those are such beautiful takeaways. And I think, yeah, that's so,
Mhm.
um I agree completely about the control thing. I think the biggest thing probably that we've all had to make peace with within a family is the relationship with control. Like, we're close
Mm.
and we've been very involved, and I think that plus people being on a commitment to a growth journey, like really focused on, just growth and evolution, and having trust and patience in the process, like having trust in the other people that they're on their own journey that can be different than yours. And I think the only thing I would add, I mean, I agree with everything you said, is just always keeping in mind a vision for how beautiful it could be, like, within a family. I think during, like, the harder periods that we've had in life, like in our 20s, and when there's been maybe even more controversy, you know, there was always, I think, it's kind of that manifestation piece of, like, keeping in mind what the vision you want in a family is, the beautiful kind of ideal vision of closeness and thriving and intimacy and collaboration, and keeping that in the mind's eye, and feeling like that's possible. And that, I think a lot of people think like, oh, families, are stuck in their ways and patterns and whatnot, but keeping a vision in the mind's eye of the beauty that is possible. And because something I think about a lot is like, how is something going to come into fruition, especially something as complex and difficult as like a truly thriving family dynamic, which is so complex and interdependent, especially in adulthood when people are more separated and living different places and having different lives. How is that beautiful vision going to come into existence if you don't have it in your mind's eye of like what is possible? So just thinking big, thinking limitless, having hope, having a possibility in your mind. If you don't have that, no one else in the world is going to be imagining that for you in your life. So I think that you have to imagine things before they can kind of come into fruition. And sometimes I think it can take years for things to truly evolve into full expression. But that's just also something that I think a lot about, is just like keeping beautiful visions alive for what you want, whether it's family or anything, career, whatever. And then let the universe guide you towards making that happen. But I think the visioning and the some people call it manifestation, whatever, I think is also something that I think a lot about. So, okay, totally going to shift gears here. Couple hot takes I want to hear from you. So, I think it's been really interesting this past couple weeks that since RFK Jr. has been on Rogan, like he's getting like double digit support from both Democrats and Republicans. And it's kind of crazy how quickly he's kind of burst into the zeitgeist. And I'd love to hear your thoughts on like why he's gaining so much traction, particularly since like his entire Rogan episode was basically about health. Like, what is he tapping into that is so important right now?
How hot can we go on the Levels
Go hot.
podcast here, Case? Okay. So here's my takeaway on the RFK thing. So I think anyone on a podcast talking about RFK, they're inevitably about to self-censor because it inevitably gets into vaccine because he's hung his hats on vaccines. And I'm trying to unpack this because it's like, okay, so he's talking about vaccines a lot and he's resonating with a lot of people. He has the highest approval ratings of any presidential candidate. And my psychoanalysis on it is it's much wider than vaccines. I think most of the country, right, when they, I think it's probably right that, vaccines generally have done good and it's good for most folks to take it. I don't think that's really what's at issue. I think what's at issue is that why has that issue, we've been totally barred from even asking a question about it. I think it represents this parenting of the American people, this infantilization of the American people, a policing of where they can ask a question, and why. And when you peel it back, why is a parent, before they're going to give 70 pharmaceutical shots that by the nature of the shot and the advertising of what they do changes the immune system for the rest of that child's life, why isn't that parent even able to ask a question? Like why is that parent labeled anti-science and kind of a Neanderthal for even that? Why that issue? And the truth is, from my experience, is that it's because those products generate hundreds of billions of dollars for pharma. It's not insignificant. These are one of the most important businesses in the world as far as the revenue, like products. They're mandated for every human to take, and basically paid for by the government. So I think what's resonating, because I think a lot of people are, there's just an anti-vax stream. No, I think it's a very bipartisan group of people, and I don't think it has to do with vaccine specific. I think it's like, why do we have like a state and media sanctioned inability to even ask a question of a pharmaceutical product that we're mandated to take, and by its advertising as a very powerful product? And I think it ties into COVID. And I think it ties in the fact that just the COVID policies writ large, which were essentially, we have a pharma-owned oligopoly more than a democracy, where the most powerful entities in government were in joint work with pharmaceutical companies to push a pharmaceutical-based agenda on COVID and a lockdown policy. It's like, I don't think we've grappled with the fact that the COVID response was the worst public policy decision of our lifetime since World War II. The amount of money, the amount of jobs that were destroyed, the amount of lives that were destroyed, the amount of issues with children and developmental issues and mental health. We haven't even grappled with this, and we're still being berated for even questioning pharmaceutical companies now, right? It's just like, so that's what I think it ties to, Casey. And I think why health, why this, like, we almost get gaslighted. Like, why is this the conspiracy theories around pharma? Because we're all getting sicker. Because the most important element in any person's life is their ability to thrive. And 80% of the American people are overweight or obese. 50% of adults have prediabetes or diabetes. We're dying younger. The most sustained life expectancy drop since 1860 that happened well before COVID. Mental health problems are off the charts. Like this is the most important issue in the world, and we are anti-science for asking questions about it. I think that's the anger, and I think it's kind of like with me, and I've been able to isolate a story on Coke paying off the NAACP. It's a way to really crystallize the. I think most people are like, why the hell aren't I able to ask a question for my child on a vaccine? Like, it kind of crystallizes the larger issue. So I think that's why, and we'll see. We'll see what happens with RFK, the American presidential campaign. I think a benefit of it is it really shows the soul of a person, and he has, many more months to be vetted by the American public. But I think right now it's very real and very serious what he's tapping into, which is giving voice to why are we being berated as American people for asking questions when we're all getting sicker, fatter, more depressed, more infertile? We should be asking questions, and we shouldn't be gaslighted. So that to me is what it taps into, Case.
Yeah, no, I think that's such a great perspective that I haven't heard before, which is that it's not about the vaccines. It's about the ability to ask, questioning this new normal of not being able to ask questions. And I think that's really pissing people off. And he's basically giving voice to that through the vaccines. But like you said, similar to your Coke, it's all communications, right? Like your Coke tweet crystallized an issue that is much broader, but really gives something for people to grab onto, and it's sort of similar to what RFK is doing here. And I think it's not about the vaccines; it's about the inability for Americans to ask questions, and that's a huge problem in democracy. And he's tapping into that, so that's really interesting.
And I'll just take it one step further. Doctors are telling parents they're committing child abuse, right, by even asking a question about the vaccines, but saying sugar is okay and not raising alarm bells when we have, a food-based metabolic health crisis, which is the real issue among kids, right? When you have a cancer patient, right? If that cancer patient doesn't follow the exact regimented like pharmaceutical and procedure strategy, the patient has to sign like a legal letter saying that they're being negligent as a patient. But very little talk from oncologists. Cancer is a preventable condition. Cancer cells, and there's increasing research on this, and it's complex, but feeds in a large way on glucose. So it's like there's not the same when doctors are militant about something, which they often are, usually about a procedure or pharmaceutical product. It's like people follow that advice. Like the medical community has an ability to like get people in line. And I think there's just something very off that let's just take COVID, and the response to that. Just absolutely unrelenting communication from the microphone of the NIH and the White House on taking a pharmaceutical product for 2 years. But again, that is a small part of it. It's just a small part. This was a metabolic health, very tied condition. And, the fact that like aggressiveness from public health leaders wasn't tied to like getting Americans in shape, it's just like they've lost credibility.
Mm.
And it's the most important issue in the world. Like what we're both fighting on, I think, is like, why can't public health officials communicate what's actually happening? I think it's because it'd lose money, and it would actually destroy the economy in the short term, because health, as I said, is the largest industry. And if you have less sick people, it would actually, in the short term, actually wreck the U.S. economy because so many people are employed. So, but long term, it would be the greatest thing for the United States. It would unleash human capital. So I think, to me, that's the issue at stake here. And I'm glad, frankly, folks from both sides of the aisle are talking about it.
Yeah, and I agree with you that I think it could have like really huge reverberations across the economy if all of a sudden this shifted, but not if we implemented some changes in the business model of healthcare like alongside
Right.
that. I think we talk about this in the book that we wrote that's coming out next year, but like there was this sort of movement towards value-based care with the Affordable Care Act, which was the idea that like we would pay doctors more for better outcomes. Because of course, like you said before, high value is good outcomes over lower cost. And so that seemed really exciting for prevention because, oh my gosh, the cheapest thing you could possibly do with a patient is have them like walk and sleep. But, these things are literally free and have the best health outcomes. Unfortunately, though, what happened with that sort of like seemingly good intention was that the outcomes that were listed for doctors to basically report on to get higher reimbursement were not actually to have a patient who was healthier. It was how much their patients were adhering to medication regimens. So outcomes based on this system were actually co-opted by pharma to be like, okay, a good outcome is a patient who's on compliant blood pressure therapy if they have high blood pressure, not a patient who's actually reversed their high blood pressure. And truthfully, like I feel like if we tied payments to good health outcomes, and you said to just, Dr. Joe out there, starting in a couple months, you're going to get paid more if your patient reverses their hypertension. um,
Mm,
Things would change instantly. It's like it's all
mhm.
incentives, like you talk about, and so I think there's ways to make it so that people don't. I think pharma would probably suffer, and maybe hospitals, and like you said, those are some of the biggest industries, and so it would have economic implications. But I think if you change the incentives, innovation will follow in really amazing ways. So it'll be fascinating to watch unfold, and I'm glad we're talking about this. This is a perfect segue, I think, to talk about your company, which is TruMed, which is the most
Mm.
exciting company, literally. And I'm not saying this because I'm your sister. I'm so deeply and profoundly excited about what you're doing. It like keeps me up at night. So can you just describe what TruMed is and why it is going to really help with a lot of these issues that we're talking about?
So I've been inspired by trailblazers in the metabolic health space, like Levels, and I think that's a vital baseline to give people the data on what's happening inside their bodies and really understand what's happening with metabolic health. And I thought a long time, inspired by Levels and other leaders in the space, just about a question. Okay, so metabolic health is the baseline of health. How do we actually incentivize it? Because not to get too on the political soapbox here, but you look around in a public space, and obviously many people are unhealthy, but I still see determination among the American people. Like, I don't think people are trying to be systematically obese or systematically get heart disease and cancer and not, make their kids, you know, f- their kids' weddings and milestones. I have a little bit more optimism in America, but I think the deck's stacked against them. I just think, as we've talked about, the incentives of healthcare is for people to get sick. Healthcare doesn't kick in until then. We subsidize crappy food in the meantime. So that's what I really thought about for a year, Casey. Inspired by you. It's like, okay, so stop complaining about it. People don't want to be lectured. How do we make broccoli the same price as a Big Mac? Because if it was, there'd be people that buy more broccoli. It's just simple economics. I started with this thought experiment. It's like, we spend more on diabetes management in the United States than the Defense Department. A lot of that's for people on Medicaid, lower income. It would be much better public policy to just pay every lower income person who's diabetic $1,000 a month to exercise. It would literally be a better use of money and achieve better long term results. So I'm like, can we do that? Can we actually change incentives for people to exercise to eat healthy? And what I found is there's one tool to do that that's very powerful with the HSA FSA. So real quick, 80% of the American people have access to one of these HSAs FSAs. I generally haven't used it because it's seen as this money for when you get sick, for drugs when you get sick and there's fear of losing the money. So actually, from our mutual mentor and Lord and Savior, Dr. Mark Hyman, he actually has talked a lot about food and medicine, and actually has talked about how he writes doctor's notes sometimes in his functional medicine clinics for food and exercise. And these notes, these letters of medical necessity, actually make literally food medicine. If you tie food to the prevention or reversal of a condition, it counts to the FDA or IRS definition of medicine. So we started digging through that with lawyers, and it's very clear. As much as pharma lobbies, they're not able to lobby into a bill that medicine is only a manufactured drug made by Pfizer. So that would be a little bit too much of a stretch to actually litigate that in law. Medicine is what a doctor says can prevent or reverse a disease. Okay, prevent. Well, as we know, the vast majority of people are at urgent risk of metabolic dysfunction, and 60% of the country has a chronic condition. So there's a wide patient population that either has a chronic condition, which could probably be reversed by food, or is at risk. The American Heart Association has actually said that every adult should be on a statin because we have such a metabolic health crisis. We agree. We think there's a massive metabolic health crisis, and instead of a statin, we think every adult should be on a prescription for broccoli and exercise. And actually, doctors can't prescribe that. So that's what our company does. We make it as easy and compliant as possible to get a doctor's note for metabolically healthy items, from an 8 sleep to supplements to fresh food, hopefully Levels one day. And and with that note, save, spend tax-free money, save 30, 40, 50%. And the way we're doing this is literally just putting a survey right in the payment flow. So just like you might take a credit survey to do a firm and pay with that, you just take a couple minute survey that meets the compliance standards for an asynchronous medical consultation. Buy the product with your HSA FSA if you're trying to prevent or reverse a condition, and then you get the compliance information. You just you get the note from us asynchronously. So that's what we're doing, Casey. We're working with mission-driven brands, and soon you can go to TruMed.com and see some of your favorite brands. And if you've got your HSA FSA account, you can use that money, not waiting to get sick and buy drugs, but to stay healthy right now.
I'm so excited. What's the number of dollars in a HSA FSA accounts that are literally not being used every year?
Yeah. Yeah. So as I said, they're under optimized, but even with that, there's $140 billion sitting in accounts right now. And about 92% of that sitting in cash. It's just, people don't know what to do with it. If you work at Google, Amazon, Apple, a lot of these large tech companies, a lot of the big financial companies, a lot of these Fortune 500 types, you probably have an HSA. I've talked to a lot of people at those companies who look into their account. They have
Oh
$10,000
my
sitting there from
God.
their 5 years working at the company. I believe Google, Amazon, companies like that give up to $3,000 a year just plop it in the account. So there's a lot of excess money. So my message, to anyone listening to that is, we want TruMed to be an act of legal rebellion against the healthcare system, really. I mean, this is a way, for you to use that money that's been sitting there. I think the cynicism we all have about our health insurance, just kind of like there for catastrophic issues or buy drugs if we're really sick. No, you can use that tax advantage money to buy metabolically healthy products. So we're getting some really cool brands on. It'll keep being updated at TruMed.com, but yeah, that's what we're trying to do. And Casey, yeah, as we get into open enrollment, it's just one button on your health insurance. If you have access to these, like most employees, you just contribute whatever you want, a couple $1,000 now. You can feel safe with TruMed that you can now buy exercise, buy food, buy supplements. You can save real money on these good products.
It's so amazing. Like I've never had an HSA FSA because I just didn't really know what I would use it for. And so, but obviously now, since you've started this company since the last open enrollment. So for this year, my plan is to basically max out my HSA FSA and then probably get a cheaper high deductible plan for catastrophic emergencies and make that monthly premium less. I'm mostly saying this to ask you if this is a good strategy. And I know you can't give tax advice, um, but and then ideally, I'm just excited about a world that TruMed is ushering in, where for the first time ever, the healthy stuff is going to actually be the cheaper stuff. Like right now, we're so backwards in that we use taxpayer money to subsidize unhealthy foods like commodity crops that are turned into processed foods. But maybe in the future, next year or in a couple years, I'm going to be able to basically get tax free for all my fresh food, my gym membership, my therapeutic massage or whatnot, things that are all keeping me healthy and ultimately going to cost the system so much less because I'm a healthy person. So this just
Right.
feels truly like this silver bullet to kind of go around the poor incentives that have been designed by using a totally compliant, tax system to
Right.
actually make the healthy choices cheaper, which, you know, we're only going to make a dent in the healthcare crisis so far if it's more expensive and harder to be healthy. When it becomes easier and cheaper to be healthy, I think only then are we going to cross the chasm to really make health accessible to everyone.
It's just that simple. We don't price in the externalities to the disaster that ultra processed food is doing, right? A Coca-Cola is cheaper than a water at many stores because there's so many subsidized ingredients. So that's what we're trying to do with this model, bend the cost curve to make that healthy food 30, 40%, cheaper. And that's inevitably going to change incentives. And then what we hope to do, what our dream is long term, is that if we can show results with this, which we're seeing great indicators so far, I mean, it's free money on the table, to use that as a model to change other programs. I mean, as we talked about at the beginning, SNAP, or what used to be called food stamps, is the most criminal program I could think of. Why is a lower income single mom who's really struggling to do the best she can for her child, relying on a government program that pays for essentially what I think are poisonous addictive drugs, sugar water, Coca-Cola, et cetera, for that kid. That's letting that mom down. That's letting that kid down. So what we hope to do is, this should be a model for SNAP, that, you have doctor recommended ingredients, that we make sure we have enough money on the card for those ingredients. But that would save trillions of dollars of downstream health impacts. So
Mm.
that's the model. I'm really hardened, going back to the political days. I've met with the White House, with the Biden administration. I met with members of Congress on both sides of the aisle. This is a policy that's been affirmed, and both sides support. I mean, I do think both sides and most members of Congress, have kids, are concerned about health. I think the influence of pharma and big food is big, but yeah, this is hopefully something, it seems like both sides agree on. It's been validated, and yeah, just that easy way to steer some of those healthcare dollars, not to pharma, but to food.
Amazing. So, Calley, since the tweet that went viral and 12 million people saw, you have been on Fox News probably over a dozen times. You've been on most of the top health podcasts in the country. You have just been evangelizing this message about our rigged system. And you've actually been in touch with and invited to speak with many members of Congress and politicians and others, and have yet truly, I mean, you flew to DC, you've talked to a huge group of lawmakers. It's been incredible. And I'm just curious, like, what is your takeaway from talking to a lot of these people who are in policy about where the leverage is right now for making positive change in the chronic disease epidemic and the rigged food system? What are you seeing in terms of the political environment, where the leverage is, and what maybe like a constituent can do to influence the conversation?
Yeah, so I think on the high long-term level, I'm very encouraged. I think the United States often, it takes a long time getting the right answer, but usually does, and it's very messy. So I think what's concerning me about our health problem is I do think if we fail as an American experiment, the number one reason's going to be because we let ourselves get sicker, fatter, more depressed, more infertile, while bankrupting our country due to healthcare costs. And I do think that's a very real threat. I mean, that is what's happening right now. Um, I think mathematically we have to change what's happening. I think our eyes gloss over when we talk about healthcare costs, but 20% of GDP growing at twice the rate of GDP and not slowing down, that's going to be 40% of GDP, in about 20 years or less. And we're not getting better. We're not getting healthier. So I think there's a little bit of awareness. I think talking to 40 members of Congress the last month, I don't think they actually fully understand why. And I think why, and the only way to solve this is getting back to basics on food, is shifting healthcare dollars to food, because the reason costs are going up is because we're getting sicker, right? The problem isn't like that Medicare Part D, page 100, has the wrong like marginal tax rate for like health insurance or something, which everyone's debating this trivia. The problem is that everyone's sick. The problem is that 80% of Americans are overweight, and we're all just getting systematically sicker. Like that input is the problem with why healthcare costs are going up. It's because we have the sickest population of any developed, country, almost any country in the world, and it's getting worse exponentially. So you have to make people healthier in order to turn the cost curve on health. And the only way you can make people healthier is ensuring that they're ingesting less poison. And you're not going to drug our way out of the situation. This whole thing of like the miracle of this new obesity drug, or the miracle of this new Alzheimer's drug that we spent, $100 billion on R&D. It's like, these are all charades, right? We're not going to drug our way out of Alzheimer's, diabetes, heart disease, cancer. They're all the same thing. They're all metabolic dysfunction. So I was actually literally on Capitol Hill, and Mark Hyman, who's, an advisor investor for us as well, huge, we talked about him a lot today. He was randomly there too, lobbying on metabolic health. So the cavalry is out, and there's a lot of people starting to understand this, and it's long term, and I am optimistic. What's the problem right now? The problem right now is that Coca-Cola and big food are lobbying today in every office in Congress to keep food stamp funding for Coke, because that's up for debate in the next couple months. And there's an all-out push right now. So they're able to target specific
issues. So if I have one call to anyone listening who wants to do something right now, it is, for the first time maybe, call or write your member of Congress or senator and focus on a specific issue. And the issue I'd focus on is say, we should not be using SNAP funding, food stamp funding, to fund soda. Simple. Marco Rubio just put a bill forward. I hate to get so tactical, Casey, but balancing the targeted lobbying that industry can do with the dispersed right now, everyone concerned about this, all parents concerned, but they're not exerting force on specific issues. That's always the problem with policy. So what I'd hope to see is that we can marshal this intense frustration people have about the fact that they and their kids are getting sicker and target that more to advocating specific policy proposals. Because I've been told that a leading member of Congress just told me this just a couple weeks ago. He said, listen, I'm not an evil person, right? And I'm also not a coward. Like if a food lobbyist comes into my office, right, and I've got 100 moms calling me the day before, lobby for a specific issue, I could tell that Coke lobbyist no. I'll tell them no. But if I have no counteracting balance, if I have them, giving me $1 million and saying, hey, just support this one issue with the SNAP funding, here's some studies, and I've got nobody, they're like, I've got the war in Ukraine, I've got 50 other items. I'm not a health expert. So that's what's happening now. Like if there's grassroots support, so that's what I'm working on. Long term, I think there's anger. I think there's frustration. I think people are waking up. I think the tides will hopefully turn. Short term, call your member of Congress and say, why the heck are we spending billions of dollars of government money to addict lower income kids on Coke and other soda? You should not support that. That actually does make a difference.
That's a hot take. I think that's fascinating because I think that people would say like, you always hear like, call your congressman. And it's like, what does that even mean? Is it a waste of time? And it's like, you've actually been talking to these people, and many of us don't have the opportunity or privilege to do that. And it's like, what you're seeing is that like the thing about the balance is so fascinating. Like if they've got this voice from industry saying, here's a bunch of studies, this is why it's good, this is why it's important. Right. And there's literally no one else calling and saying, their constituents saying, no, we do not want this. This is not what we want. Of course, they're going to go with that, with industry. And so I love the idea of like, focusing the effort towards specific issues. It almost feels like there's some sort of business there, like of like, how do you actually, because I'm telling you right now, like, I don't know exactly how I would figure out, like, I live in California. What are the issues that are up for debate? And like, who do I call? It seems like really overwhelming. So we need to talk more about that as a family.
Yeah,
and like,
it's, I mean, we've got both of us have a lot of, we're running our companies, writing the book. We got a lot. So I've actually been contacted by some lobbyists, some great people, and actually some people are trying to put a group together. If I had $1 billion, there's a lot of lobbyists for Coke and Pharma. There's not a lot of lobbyists for diabetic kids. You need counterbalancing force. And I just want to underline, Casey, something you just said, and I've been really surprised by it, but it's the one message I'm hearing consistently, which is it's not as transactional as you think with money. It's just like these special interests just galvanize the conversation, and grassroots support really matters. Like there's not like a ton of money behind the most powerful issues in the country, like abortion and gun control. The issue actually is that those galvanize voters. Like people vote on those issues. People are calling. People are showing up to the town halls. The world would change if the millions of angry, quite frankly, parents out there on the rigged health system, how it's rigged against kids, if they were able to mobilize, just putting this out in the universe, because this is something people need to work on. If they could be mobilized in a tactical way to go to town halls, to write in, to have members of Congress feel the pressure, to feel that there's a cost for them just sliding in that thing for Coke, the world would change. And I do think this is needed.
Yeah, I mean, you and I have both devoted with Levels and TruMed to changing consumer decision making to shift the industry, which I think is another really big piece of it. Because if people demand different products, the companies will respond rapidly. But this is a separate piece that I think is so important. So that's really important. So final question, and then we'll close. Calley, you have spoken out publicly, as have I, about some concerns about the overuse of Ozempic and other GLP-1 agonists as like this panacea that's going to solve the metabolic disease epidemic. I'd love to just hear your take quickly on why you feel that this is not the answer for our chronic disease epidemic, and why it might actually be too good to be true.
If you ask anyone in America what the point of a chronic disease treatment is, they would say to cure and reduce cases of that disease. There has never been a chronic disease pharmaceutical product in American history that has lowered the rates of the disease it's ostensibly trying to treat. So let's just think about the past couple decades. The more statins we prescribe, the more heart disease goes up. We're prescribing record amounts of metformin. Diabetes is off the chart. SSRIs is the most popular drug in the country. Antidepressants, depression, suicide is off the charts. You just go down the list. Ambien, sleep disorders go up. Blood pressure medications, blood pressure rates are going off the charts. Literally, why is this? Why are we have a treatment for every siloed condition, but everything around us is going up? I think when you peel back, it's very simple. That and the American Heart Association, the American Diabetes Association, they've actually said this in their guidance. The ADA actually, as Lustig pointed out, Dr. Lustig, until 2018, essentially said if you take your medication, you can eat whatever you want. No matter what cardiologists say, they paid lip service to diet. It's essentially, take the statin, you're doing something now. People, I can have my burger. The message with all of these things is that taking that drug is doing something in and of itself. And it's not. If you take your statin and continue to eat inflammatory food, if you take your metformin and continue to eat glucose-raising food, you're still doing metabolic dysfunction to yourself. So imagine now with Ozempic, a child, because it's 12 years and up, is prescribed Ozempic. And that child is said implicitly, and they're actually being said this by the Harvard physician, Dr. Fatima Stanford, on 60 Minutes, that obesity isn't tied to diet, right? And throw willpower out the window. So a child is being given Ozempic, a lifetime drug, and said, what you eat doesn't really matter, and they're not being trained to eat metabolically healthy meals. They're continuing to feed their bodies for the rest of their lives with metabolically healthy food and have metabolically unhealthy habits. They're going to get other comorbidities. The whack-a-mole doesn't work. And this is the most important one yet, because the market size is 80% of Americans, because 80% of Americans are overweight or obese. I think it's just continuing the road of whack-a-mole pharmaceutical products for chronic disease. And then I think very importantly, and this is also the case with the $4 trillion we spend on healthcare, most of it to chronic disease, it's not working. There's an opportunity cost. So let's just take obesity. We know that when volume goes up, drug costs don't go down because you're not able to negotiate drug costs as the government. It's the only industry in the country where the largest buyer can't negotiate costs, so costs don't go down. So Ozempic is going to cost estimated $10,000 per patient per year. We could just steer 50% of that, 25% of that to reinvigorating regenerative agriculture in this country and feeding kids healthier food and subsidizing that food for obese kids and adults. Why are we jumping so quickly to a pharmaceutical product when the root cause is food, is metabolic habits?